to give a very brief introduction to where we are currently with respect to the position of metaverse. So, as all of us know, every day to day, newer technologies change our lives, the way how we live. Probably, if you think of 1980s, when internet was starting to bloom, at that point of time, nobody ever has imagined that this amount of impact internet would introduce. Similarly, close to 2000, before the dawn of this 2000 year, we never even imagined that all our mobile phones will revolutionize our day-to-day activities. So like that, now we are actually in an era where all the disruptive technologies are transforming our day-to-day activities. Not only day-to-day activities, it is also changing the way how we communicate, how we connect with people, how we do business, and also how the industries function. So everything is being completely and drastically getting changed. So now the buzzing word which all of us are hearing is artificial intelligence. Everywhere we talk about explainable AI, IoT is another word, 5G communications, uh, virtual reality, augmented reality. We talk about different types of computing, fog computing, edge computing, cloud computing technologies, blockchain technology. So all these are slowly penetrating into our lives and the way how we start to function. And metaverse is not an exception to that. And I would say metaverse is basically a collaboration or interconnection of all these technologies. It's a vast interconnection of virtual space. And in my presentation, I'm just going to tell you to what extent the metaverse can penetrate into the healthcare industry. What are the potential applications that we would expect for? And maybe it is only at the scratch level. It can even go beyond that. Nobody has ever imagined. Whatever has come to our imaginations, that is what is actually listed now. So let me get into the next slide. Just tell me whether my slides are moving. Can you see my slides moving now?
Yes, ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
So
Ma'am.
is there any issue? Please tell me.
No issues, ma'am.
It's moving fine. Okay.
Yes, ma'am.
So what we are going to see, how I've prepared my slides and how I'm going to present is, I have divided my entire content into four modules. The first module will be as usual, like anybody to begin with, we need to give some inputs with regard to what metaverse is. Maybe all the earlier speakers would have given much more detailed version of what metaverse is, what I have understood, and what exactly is the evolution history of it, how it has evolved, and what are its tech components associated with it. These things I'll be telling you. Then we will dive into what is the significance of using a metaverse for healthcare. Is it very apt to use metaverse for healthcare or not? And what are the pros and cons in this? Then possibly we'll move on to all the potential applications of metaverse in healthcare. Final module will be like what are the challenges, limitations which are still existing? Why the adoption of this metaverse is not quick in all the industries? What are the liabilities? And what are the other as issues which really delay the process in the adoption of uh, metaverse for healthcare? So everything will be in the context of healthcare, I'm going to tell you. So next we'll quickly move on to module 1. Maybe I need not spend too much of time on this. So if you look at the history of metaverse, always my habit is I begin with where exactly it started, so that that will inspire many of us to proceed further. So if you look at the history, you can simply imagine it as a video game. And it was the name of the video game which was introduced in 2003 was Second Life. And it was in that particular, though already many video games have come earlier, but it was in this particular game the concept of avatar was introduced. Okay. And I could hear few I was able to listen to the earlier speaker. He was mentioning about avatar, so you must be knowing it's basically the digital representation or a digital reflection of a user who's attempting to explore the metaverse world. Okay. So the concept of this avatar was introduced only in this video game. And if you look at why this name as metaverse, who has coined this term and why it has uh, come out like this, if you look into that, it was this Facebook CEO who has actually rebranded this Facebook app as Meta. It was in October 2021, very recently, in a Connect conference, he has done this. So when Facebook is basically a social app. Added to that, if the communication between the people is also not only in the real world, if it is extended to digital world or to the virtual space through AR and VR, how would the interaction be? He started imagining that, and that has resulted in the rebranded name as Meta. And because all the users who are using this Meta will dwell into a physical world, or rather I would use the word universe. That last term, universe, verse, is combined, and metaverse is coined like that. So if you look at the meaning of why meta actually signifies uh, the going beyond the physical world. That is what is actually meta basically. So it metaverse actually refers to the vast interconnection, like how we someone if ask you to define what internet is, we say it is a vast interconnection of networks. Like that here, it is interconnection of lot of digital world. Not only digital world, even real world can be mixed up. It's a mixed world and a virtual space. Everything mixed together is what is this meta basically. So this is the definition, simple definition. You must be knowing about this. So I'm going to skip the slide. I'll just read out what it is. It's a virtual reality space in which users can interact with the computer generated environment. And not only with the environment, the users among themselves also they can interact in real time. So they will have an fully immersive digital experience when they use this metaverse. So what is this metaverse comprised of? So few terminologies which we are supposed to know is virtual world. As I've told you, it is the entire digital environment which the user is going to explore. The exploration can happen to any place, like it can be a space, it can be an island, it can be an ocean, or it can be any city. For example, imagine that I wanted to have my dinner after this presentation. I wanted to go to a place where near an island or something like that. I just have an imagination, and if I use this digital gadgets like handsets, okay, and the glasses, VR glasses or AR glasses, I'll be able to visualize that I have, although I have really reached the spot and I'm just enjoying my supper, something like that. So avatars basically, as I've all told you, it's a digital representation of users where they can interact within the virtual world. In the real world, avatars cannot exist. And interactivity, so the ability to interact with the objects, not only among the people they can interact, among the users they can also interact with the objects in the virtual space. That's another thing. So that interaction is also is possible. And even when the user comes out, logs out of the metaverse world, okay, he moves out, even then the existence of this virtual space will continue. That's what is persistence. And interconnectivity is, there will be a seamless interconnection. The switching over from one digital realm to another world will not be visible at all. It is a seamless interconnection among all the virtual environments as well as with the real world. So all these things, this immersive experience, deep parallel immersive digital experience, is possible only with the help of some digital gadgets. We call them as immersive tech gadgets. So with the help of this, there is a possibility to blend the digital world or the virtual space and the physical world. And this offers enormous opportunities for communication, entertainment, education. Initially, remember, this concept of augmented reality started with entertainment, but later on it started to closely move on to the other sectors also. And now, of course, with the digital healthcare. So let me name few of the immersive technologies. Like we have something called as augmented reality, mixed reality, um, virtual reality. Now this, there's a very slight difference basically. If you take augmented reality, just look at this image, you'll be able to see. Suppose you enter your hall, right? Where there is no furniture present, maybe a new place you are entering, and you can just imagine to have a fully furnished, if what sort of furniture do I require in this space, or what will fit, which color will fit, all these things you can really find out with the help of your AR glasses. So with AR or augmented reality, you can overlay things or objects in the real world. So anything which is imaginary can be overlaid in the real world. This happens in augmented reality. In virtual reality, it is not overlaying something on real world. It is completely getting immersed in a simulated digital environment. You will not have something as digital world. So you will acquire a 360-degree vision of only digital or artificial world. So nowhere the real world come into the picture. And mixed reality is basically having both, combinations of both. So it is going to coexist, the real world objects and the digital world uh, objects will be coexisting, and you can, it's possible for the users to interact among themselves as well as with all these objects. And you can see that here, to illustrate that these two people are using a headset, VR headset, and this person is trying to capture a digital object which they have imagined. So that's what is shown here. So both digital world as well as virtual world, and interconnection between them is going to happen in mixed reality, or sometimes we can also call this as hybrid reality or extended reality. So the first version is of immersive technology is augmented reality. The next version is the virtual reality, and hybrid of this is the mixed reality. So if you look at extended reality, it is combination of all these technologies together. So you can see that it permits the digital avatars to explore the digital world around them. That is, which is what is shown over here. You can see an avatar just trying to push into a space and trying to explore what is there in the digital world. Okay, that's what is shown, and these are different avatars which are already existing in the scenario. And you can also think of a girl, say for example, I just wanted to know, find out whether a particular garment suits me or not. What I can do is I can use the headset, VR headset, or an extended reality headset, and you can see that a lot of dresses are hanging over here. If I wear that exactly the same dress, how would I appear? How would I look? So that kind of thing can also happen. So definitely, this is going to play a very massive role in all the markets. Okay, particularly in garment industry, all this. Maybe Amazon and all other agents might take up this. Okay, this is a fantasy part of metaverse. Moving to the enabling technologies, how this fantasy is made available, this imaginary world is available to the users. If you look into that, there are a lot of technologies, interesting technologies, but we can really see that I have shown here. uh, so AR, VR, and mixed reality, all this overlap, and we have something called as extended reality, social networks, artificial intelligence, edge computing, 5G communications, Web 3.0. This is your our internet version 3.0, blockchain, and different financial systems, mobile platforms and apps, entertainment platforms, Internet of Things. All these technologies combinedly constitute what is called as metaverse. And particularly, if you look at AI, what will be the contribution of AI in metaverse? We can imagine that AI can help us to power up the, or AI driven avatars can be generated. AI powered virtual assistants can also be given to the users for the beginners who are trying to dive into the virtual world for the first time. Above all, another important technology which is the catalyst for the growth of this metaverse is the blockchain technology. Because we now think of virtual money exchange, virtual money transactions. So for all this, we need to have a good security, data security. Virtual or digital money like cryptocurrency. This is known to all of us. All the we use the word digital assets, cryptocurrencies, and NFTs, which are non-fungible tokens. All these can be integrated, and they can be used in virtual transactions. Now, how do we maintain the um, security of it, confidentiality of the process? All these things will be taken care by the blockchain technology. So, one of the catalyst technology which is driving this metaverse is this blockchain. So if you look at how does it work, I think many of them would have already told you. Variety of digital gadgets have to be used. One has to use headsets, VR headsets. We have to use some good glasses. AR equipped glasses are actually readily available. Google has given one. HoloLens are available. Glasses are also available in that. And even every day we use our smartphones. You can start from the smartphones. There are a lot of apps which are available, metaverse apps. Like we have something, not metaverse apps, it's actually virtual reality apps which are available. uh, we have something called as Netflix VR, YouTube VR. All this will help us in like getting an immersive experience. Okay. And Titans of Space is something, if you want to go around planets in space, you can make use of this. So this gadget is like you have your smartphone here and you need to use a gadget, and there is a provision to hold the mobile phone on the gadget, and the entire thing has to be worn across our head like a band. Okay. And you'll be able to have access to so many different sides, and a three-dimensional view will be possible with all this. So these are some examples of immersive handsets and XR glasses and other things. Suppose you are navigating into a place where in a physical real world you're moving, and suppose somebody has invited you to attend a party or something like that, and you have started to move. Like with that XR glass, you'll be able to know where exactly the location is. You don't even have to use your mobile phones to find what is your XY or your latitude and longitude of your positions. It will automatically show you the thing. So this is a power of the technology. And so this is about module one. So module one is completely about the basics, and we'll now dive into module two. So this is where the real part starts. So why do we use metaverse? Our adoption of metaverse for healthcare industry is has got a lot of pros or cons. That is what we are going to discuss here. So why metaverse for healthcare? Let's first see that. So uh, the impact internet has given on our healthcare outcomes is far better when compared to the outcomes of healthcare industry before the use of internet. Similarly, we expect metaverse also to introduce boundless possibilities, unimaginable possibilities in health. Like how? So metaverse in medicine can also be defined like, we can assign a new term for this as medical internet of things. All of us know what internet of things is. Basically, you have a lot of sensors. So if the sensors are basically meant for not measuring the physical quantities associated with other applications, and if it is associated with medical parameters, then we call this those sensors as medical sensors, and the data which you collect out of them comes from what is called as medical internet of things. So there are three major reasons for why metaverse should be adopted in healthcare. First one is telemedicine. So we have started imagining that metaverse can be adopted for healthcare only after the adoption of telemedicine. And another reason is, as I've told in the previous slide, blockchain is also one important reason for adopting. Without blockchain, maybe there would have been a hesitation to adopt metaverse because a lot of data, use and patient data, has to be secured, and because blockchain is a distributed mechanism, security mechanism, it is possible to directly adopt blockchain for metaverse. And the what I would say is the availability of the blockchain is one important reason for the um, employment of metaverse in healthcare. And apart from that, we also have digital twins, which is like a mimic of the patient. So the patient can be mimicked, and you can have a simulated version of a patient wherein a lot of experimentation can be done, maybe starting from a surgery or a therapy, or maybe you can give a drug to a digital twin and you can see how well that patient is responding. And once everything is fine, once outcomes are seen, after that it can be tried on the real patient. So now this point itself will help us to understand what is the versatility metaverse is going to provide for healthcare industry. So these are some of the I don't know whether it's possible for you to see. So you have a lot of different technologies. Apart from what I have listed, we have human computer interface. Quantum computing is also coming up in a very big way. The speed with which the processing is done has to be improved. Big data analytics, 5G, IoT, and all those things. Next, we'll move on to okay, so I told you there are three important factors which were fueling the growth of, or which pushes metaverse for healthcare. So the first thing is about telemedicine. So the concept of telemedicine, though it is very old, we started adopting this COVID, so telemedicine, only after COVID was widespread. Because of COVID, we had series of lockdowns. So there was a compulsion, there was a compelling need which pushed all the healthcare sector to move into rapid digitalization. So this is one of the important reason for why now we are talking about metaverse. Maybe if this pandemic situation was not existing, maybe we would have not realized the importance of telemedicine, and we would have not landed up with this approach of metaverse for healthcare. So if you look at the statistics, uh, globally, telemedicine was employed only by the global population by about 43 percentage. So the healthcare sector was using it only for 43 percentage. And after the COVID and series of all these lockdowns, the remote therapy to patients have increased up to 95 percentage. So you can imagine Metaverse will be offering a virtual um, clinic room or virtual clinic where the patients and the doctor can consult with each other. Each one of them can be imagined as an avatar. Doctor will be an avatar and the patient also will be an avatar. And both the doctor and the patient, they have to have their gadgets on, digital gadgets on. And we can imagine, say, for example, I've shown an image over here to indicate that, say, this is a patient and these two are doctors who are sitting and just trying to find out what his problem is, and he's giving some commands to them. So they are not physically close to each other, but still they'll be able to interact with each other, and he'll be able to explain what his problem is. All the symptoms can be shared with the doctors, and accordingly the diagnosis can be made by the uh, medical experts or by any kind of healthcare professionals. Now the interesting point here is, when this patient has shared all his symptoms and maybe his healthcare parameters, his important health parameters are shared with it, then you can imagine a lot of medical data is going to come out from every patient for every consultation. It can come from any of the device. It can be a computer or your mobile phone or individual sensors, or even the smartwatch what we wear is also capable of measuring so many parameters, like starting from BP. It is also measuring what is your sleep level, how much time you have slept, deeper, lighter sleep, and all those things it's going to command. So all these things will be saved in the cloud, and the appropriate healthcare professional will have the authorization to access all the parameters of a particular patient. So you just imagine, from a single patient, for a single consultation, nearly 1 MB of data, assuming 1 MB of data is going to come. For the same patient, lifelong it is going to be, you can just imagine what will be the number, and it is going to happen for every individual. So computing issues are will be more, computing challenges will also be more to support that. Now, instead of earlier we were focusing only on cloud computing. If the cloud has to process all the data on its own, it's really going to um, take up too much of time, processing time, and resource constraints are also going to be there. But rather, now we are switching over from cloud computing to what is called as edge computing. So what edge computing is basically, these devices are going to share the data through the internet, right? So we have a router here, you have a computer, you have even digital assistants. All this are going to carry forward the data to the cloud. So the processing can also be done here because it's happening at the edge of the network. So we call this as edge computing. So the data which is going to be generated from every user for every day, per day, on a daily basis. Maybe if you want to see how you want to do a continuous monitoring of your health, you want to manage the wellness of the health, then a lot of data is going to come up. And remember, with all the technologies, the lifespan of the individual has also got increased. So because of this, the maybe earlier days it was 40 or 50, the that was the average lifespan, but now it is extending up to even 70, sometimes even 80. That is also possible now. So you can imagine how much of data is going to come out. It's going to be several uh, bytes of data which is going to come out. So now coming to metaverse, in what the need for metaverse is again driven by another technology which is blockchain. Just now I told you recently about the data sharing and data processing done at the edge. So now, how to prevent this data? Because all the gadgets, if they are going to be compromised, they become a malicious node. If they become a malicious node, then anybody can tap the data. Now, how would the patient and the other stakeholders of the healthcare industry be very confident that the data is highly secured and that the privacy of the patient is ensured? How that is possible? That is possible only with the blockchain. So it's a very crucial component, and all the decentralized, because different stakeholders are at different physical locations and each one of them use different gadget. So managing healthcare data security is very, very important, and that is going to be possible only with this blockchain technology. So for the administration of the medical data and for the protection of the precious healthcare data, it is mandate that this blockchain technology is applied in the healthcare industry. Okay, so the third important reason for why metaverse is more suitable for adoption of healthcare is the digital twin concept, which I've already told you. A patient might be a patient's digital twin in the metaverse. In metaverse, we can create a simulation or a digital reflection of a patient itself. So a virtual replica of a physical entity can be brought in. So when you bring in a physical entity virtually, there is a possibility of extracting data from the physiological parameters. It is also possible to know about the medical history, digitized values for the medical history and the lifestyle habits. Everything can be extracted from that. So when you have all these things with us, then it is like we can use these digital twins as test dummies. So before the real treatment or a surgery or whatever may be even therapy, or before administering a drug onto a patient, before any of this medical procedure, it is possible to first try everything with the test dummies. How well the test dummy or the patient, the digital twin of a patient, will be recovering from a surgery? How would he react to a specific drug or to a medicine? So all these inferences, data analytics can be done, and only when everything is okay, when it is satisfactory, then the healthcare providers can directly apply all those procedures on the digital twin. So what are the benefits of metaverse adoption? So if you make your healthcare system ecosystem meta driven or meta triggered, then we have lot of benefits for both patient as well as for the healthcare providers. So we can categorize all these benefits. Plenty of benefits are there. All could be categorized under three important points. One is personalization, another one seamless connectivity, and collaborativeness among the different stakeholders. So what is personalization is here, like, with the help of metaverse, personalized patient care can be given. For example, we can all the existing systems, the traditional medical approach is not patient driven. Actually, now we are slowly transforming to patient driven systems. So if you are trying to uh, do all your treatments and procedures unique for every patient, then it is like a more of personalized type of what to say, personalized healthcare benefits will be given, rather than just trying with, say for example, if it's a fever, this is what is the procedure that you apply for all the individuals. The same way, all the individuals may not be reacting to that particular medical procedure. Each one will have their own way of adopting it. So this is what is called as personalized healthcare. And apart from that, so this is the most valuable, and I would say the most interesting aspect of metaverse adoption. Though for more than a decade, people used to say that personalized healthcare treatment, preventive medicine, all these are buzzy words. still the adoption of them is very difficult. But with the inclusion of metaverse in our healthcare industry, then it is possible to really get this dreamy words into reality. Next, moving to connected. So, like, or when the sensors, the medical sensors, or I would say medical IoT devices, they can connect with each other, they can network with each other, and possibly exchange of data can also happen. They can do a lot of processing, and we can by because of their perfect connectivity with all the stakeholders, any abnormalities will be immediately exchanged with the appropriate medical expert, and for that the response will also be taken immediately. So managing health will be possible, and apart from managing health, it's also possible to uh, possible for disease prevention. So all these things on a daily basis also can be possible with this connected metaverse adoption. Apart from this, a lot of collaboration can happen with all the stakeholders, including different healthcare providers, patients, as well as the assisting staffs. Everybody can have a very good collaboration among themselves, and that would also be uh, one of the important benefit of metaverse. And remember, with all these benefits, cost wise, operational cost, the total capex cost, everything will be coming down, because we do simulation before we try exactly. So if this principle is adopted, naturally the cost also comes down. So I just thought it will be interesting if we know what are the important companies which has adopted this metaverse in healthcare. So we have something called as Lattice Healthcare. So it has developed a virtual hospital where a VR environment will be available. So it was introduced in the year 2022, basically to handle mental disorders of patients. Okay. So iMining is another metaverse company which supports the largest freestanding comprehensive tertiary rehabilitation hospital in Canada, and it is serving all patients who has rehabilitation complex rehabilitation issues will be handled by this iMining. And as far as this is with regard to the global aspect, I've only listed two here. There are many more. Even UAE has come out recently in 2022 with a hospital. It's a digital metaverse hospital itself. They have tried initially. So, partly Apollo Hospitals in our country has announced a collaboration with a company actually to enable partially the metaverse engagement, and it's the first of its kind to have this kind of initiative in our country. Apart from that, there was also a startup company called Resolve 360 in Bangalore. They have announced the first application for physiotherapy, for active physiotherapy using. So, for most of the mental disorders, rehabilitation mechanisms, all these things are very well possible with this immersive metaverse technology. They have started, and this company is growing very fast, and it is Resolve 360. So in the second module, I was trying to just give you some convincing explanation as why metaverse is more suitable for adoption in healthcare. And I told three important points, like because of telemedicine, and because of the COVID and series of lockdowns. Now this it's a boom that we started realizing what is the potential of metaverse. And apart from that, digital twin technology is also coming up, and blockchain technology is there. With the existence of all this, it is very much apt and suitable that when metaverse is adopted in healthcare industry, there can be a uh, near healthcare transformation happening because of this virtual innovation. So now we will also look into the details of what will be the possible applications, potential applications of metaverse in healthcare. So if you look at the applications, so doctors and patients, they will have lots of degrees of freedom to interact with each other. This is an added uh, what to say flexibility and benefit they get in metaverse enabled or triggered healthcare. So, like, what is the point is they don't have to really bother about their locations. They don't have to really bother about the time. Even you have an emergency. Usually, emergency happens at midnight or something, and we find it very difficult to rush to the hospital at that point of time because not the doctors will be available in the hospital. But rather, with the help of this kind of features, with the digital immersive feature, it's possible to have. So all the other limitations, you can name any number of limitations in physical world, everything can be just like that, uh, popped out with the metaverse applications. So you can have a lot of remote consultation, and you can see here a doctor just wearing a virtual reality gas uh, hands I mean headset, and trying to teach the patient, like with a physiotherapy procedure. So remote consultation, patient engagement and therapy. So this is a kind of a therapy that can be done. Virtual surgeries can be done. Drug discovery, as well as drugs can be discovered, and a lot of drug related research can also be uh, mushroomed if we are going to adopt this metaverse. And apart from that, more suitable for mental health and rehabilitation. Then we can also use this for healthcare education, awareness, medical training. All these are additional applications that we can provide. So I've just listed all the applications here. With the metaverse, we have medical diagnosis. Quick medical diagnosis can be done, like how AI is assisting us nowadays. We use AI for this medical diagnostics, so that's possible. So medical therapeutics, surgeries, medical education, and patient monitoring, alert response. If you want to monitor the vital signs of a patient, that is possible. Holographic imaging will give a 3D version of the images. And virtual biopsy is a very painful procedure, and if you make it virtual, you can imagine what will be the kind of relief the patient will have. Virtual physiotherapy, that's possible. Virtual counseling is possible for mental or psycho related disorders. Gesture based assistance, they can just give you some gestures and make you do some exercises. Surgery, nanobot surgery, virtual experiments can also be done. Drug discovery can be done. All these are some of the applications in healthcare. So if you just look into few of the applications, I have just listed some 4 interesting applications out of this. So let's start with the surgery, metaverse surgery. So if you take a surgery, all the important cutting edge technologies will usually be embraced for a surgery, and it's going to be a very costly procedure because of the preciseness which the surgeon would always be looking for. The quality of the patient life and the extension of the patient life is very, very important. The quality of the operation is very important, so that the post operative complications are all minimized. So utmost priority is given to all those things. Therefore, we use all kind of cutting edge technologies to achieve all these objectives. So the idea here in metaverse surgery is this: we are trying to use the virtual dimension. So the virtual dimension is used to make some rehearsals, like how we do some rehearsals before rehearse model exams are conducted before we take up the real exams, competitive exams. Like that, rehearsal complex surgeries are done. So if it's a very critical surgery, so we can do a lot of rehearsals, and before it is being actually performed on a real patient, we can do it. So this is an excellent advantage that we get with this metaverse. And if you look at the benefits, as I've already told you, it allows surgeons from different locations to gather in the same operation theater. Many people from different places, from different countries, experts in a particular specific surgery, though they are not physically closer to each other, they can be brought closer in a virtual world created by metaverse, and their combined experience can be good used for the goodness of the patient. This is something really very good. So all their interpretations during the surgery, all their calculations, their thought process can also be networked, and from that a common ideology can be brought in, and with that methodology the complete procedure can be done. So these are some of the benefits that we get with the surgery. Then moving to therapy. So we already have another therapy like in done in online mode. We call that as teletherapy. So I just thought I can give you the difference between teletherapy and metaverse therapy. Teletherapy will allow the patient and the therapist, both of them, they get connected only through the video conferencing mode. We can have a Zoom, or we can have some Google Meets, as how we are like interacting with each other. So this is what is teletherapy. But what is meta therapy, metaverse therapy? It is completely different. You get multiple benefits out of this, wherein a patient will get a deep immersive experience, and they can see, they can interact with the therapist, they can almost try to uh, be 100% convinced, because though they are not see, the biggest trouble with all mentality of patient is that they really want the medical experts to touch them and feel them and give the medicines. So somehow or the other, all of us are brought in this with this mindset. So the mindset is very strong among the patients. So only in the real world it can happen. Only when physically close to each other can happen, right? All these possibilities are there. So they expect the same thing to happen in a virtual world, and that is possible here with metaverse therapy, which is not with the other online mode of therapies. So mental health and therapy is another aspect. So mental health treatment can be offered because a patient, when they wear the virtual reality headsets and the necessary gadgets, what they do is they are completely taken off to a new environment, and in that environment they are made to interact with different objects and different people, as though like physically they are interacting, they interact, and they completely get come out of this issues associated with anxieties, trauma disorders, stress disorders, and any kind of phobia. All phobias they try to come out, and they felt that this mental health treatment is highly possible and it's highly successful with this metaverse rather than having it in the real world. Because in the real world, we need to imagine, we have to force a patient to go to that imagination mode and listen to what the patient, the medical expert is telling, the psychotherapist is telling. So those type of difficulties we are not going to give to the patient. Rather, the patient is taken to a comfortable zone where both the therapist and the patient, both of them, can have a good conversation. They will be able to mutually help each other. Uh, Sorry, not mutually help in the sense, the person, the expert will be, therapist will be providing all the necessary inputs to make the patient more comfortable and come out of the other issues easily. So you can see here, this image is basically like three different people. One is a psychiatrist, one is a patient, another one is a orthopedics. So all of them are trying to console the patient who is sitting over here. So it is all happening in a virtual mode. So psychotherapy using meta, this I've already told. So there is huge benefits with this. They can feel very comfortable with this. because they have a face-to-face sessions in virtual meet rather than the virtual meetings. That is what is the advantage that we get. Professionals can actually, there is one more therapy like VR triggered therapy, where with the VR headsets you can see all the therapists using all this VR devices. They what they do is they can recreate necessary real world circumstances in a controlled environment, and they can help the patient to overcome their struggles, okay, what they face in the normal life. Then coming to surgery is over, then therapy is also over. Now we'll move on to combining all the surgery, therapy, monitoring. All these things happens in a hospital. So in India, there's a Metaverse hospital, first Metaverse hospital on Decentraland in Hyderabad, and one more in UAE. October 2024, they have started. It's a fully virtual hospital where basically the patient can take up a digital representation of them like an avatar, and they can take a tour of the hospital. They can also see what are the amenities the hospital is providing and what are the treatments and services in real time. Whatever, if they travel in real time and see what all is present, the same thing the avatar will be able to experience without even traveling to the position to that spot. Virtually it is possible. So this has enhanced a lot of uh, accessibility for all the people. So this is one of the important advantage that we get here. They will be able to enter into the virtual hospital. They can immerse themselves into the space. They can also get some remote consultation with physicians who has got good expertise, so they can pinpoint a physician and get the expertise from them. So this is a scenario of a metaverse hospital. You can just imagine this is how it is going to be. I'm sorry, I'm not playing a video here. I just took some snapshots and I'm just projecting over here. This Yashoda hospital is the one which we are going to have it in India, and it is in Hyderabad. So the interior of it is shown here. I've taken from some blogs all these images. So when we talk about metaverse hospital, the moment we talk about hospital, always a hospital information system will be present. So from the hospital, you can see a lot of data will be exchanged with the hospital information system. So once the patient has moved off, all the data will be stored in his record. And similarly, again, if he is going to make a visit, those records have to be retrieved. So it's going to be a bidirectional flow of data. So now again, how the processing is done, how the retrieval is done, based on what uh, authenticity the data is going to be taken up from the hospital information system, and how it is going to be posted in it. What is the correctness of the medical data of that particular patient? So we have electronic health records, EHR records, digital health records. So all this processing will be done with the help of blockchain technology. So scores also will be given, like whether the data is not secured or very well secured, like that different scores can be assigned. So with the help of this, so ultimately what will be the benefit of using this kind of hospitals is that it removes the physical barriers for all disabled people as well. Physical barriers like distance, time, okay, and also reduces waiting time for all the patients. They can move from any country to any country because everything is happening in an imagination. So all these things are possible with it. So next, moving to the next one, which is immersive medical education. Even medical education can also be imparted with the help of this metaverse, and it is highly expected that this will significantly. This is one important sector which metaverse is actually targeting it. So you can see here basically. Um, Patient lying down, and there is a avatar, and avatar is here, and the medical student is trying to learn what the avatar is trying to convey. So digital twins and VR and AR features With all this, the students can gain practical experience even before they get into an operational theater or start interacting with the real patients. Everything, they will be completely prepared in all aspects before they get into the operational theater. Not only that, any type of anatomical models, you can see the physiological functioning of the different organs, anatomical models, all these things will allow will be visible to them, and it allows they can also rotate it in 360 degrees. They can see, they can clear their doubts with the animated images what they have to learn the human body in detail, and they can also have a good education with this. Okay, they can master over their skills which they need in future. So now I just thought that I should tell you something about uh, the benefit what metaverse will give over telemedicine. There are two interesting benefits. The first thing is metaverse enhances the quality of the care which the professionals are going to give to the patient. No doubt about this. Because if you take telemedicine, they examine the patient only through the parameters. They cannot physically have a one-to-one correspondence with the patient. In the sense, only the parameters can be exchanged. They cannot feel, they cannot touch them. So those aspects will be missing. So the three-dimensional, immersive information cannot be got in telemedicine. And second thing is, uh, with metaverse, we'll have the freedom to copy the object. Here the object can be an avatar also, it can be also an organ of a patient. From real world we can copy that into a metaverse, and we can do some manipulation in it. We can do a lot of simulation over that, set up some experiments. And with all this, lot of opportunities in medical education, diagnostics. You can do a lot of predictions and also testing. Everything is possible with this. So medical training, as I've already told you, it is the training, medical simulations and training. Already now medical simulations are available in most of the hospitals. All the PG students undergo that. And one such course I have also undergone. That's why I also know that. So they are all very central to the training of doctors, nurses, not only for the doctors. When I say medical healthcare professionals, it's not only the doctors, nurses, and all the medical staff. Everybody will come into that. All of them are stakeholders of it. So the basic idea here is the medical practitioner has to have access to the realistic scenario. Okay. And rather than having access to the realistic scenario directly through metaverse, they first get familiarized with it, and they can hone their skills before they enter into or jump into the real world scenarios. So that is what is happening here. So you can see here, the projection is being made, and the doctor is actually teaching. The teacher is medical expert is teaching to the students, and he's trying to explain the MRI images what he has got. For all the slices are brought in the same image, and it is taught to the students. Same thing is happening here in a surgery room. The training is actually happening here. So apart from this, the list of interesting applications is medical training and education, metaverse surgery, mental health and neurological treatments, and blockchain, medical procedure assistance. This is also very interesting. Physical therapy and rehabilitation, and blockchain ecosystem for payments. Again, when we talk about consultation and whatever may be the case, some payments have to be done, right? Even for the payment processing, we can make use of blockchain ecosystem. Not only for the data security, even for payment processing, that say processing digital economy security can also be brought in with the blockchain. And AR VR infrastructure for biotech, everything, eye tracking, all these are some of the examples. So all the technologies which I've already shown, with the help of the technologies, what all possible outcomes will come. Okay, so everything is altogether what is called as a healthcare. And here these slides are going to be with it's going to be loaded in the portal. That's what Madam Sangeeta has told me. So I just thought I will leave it just like that. Then the last module which I'm going to touch upon is adoption of metaverse. What are the challenges and the limitations? So, having seen to what extent metaverse can penetrate into the healthcare industry and the kind of benefits, potential benefits, and applications of it, we are thoroughly immersed, and all of us would immediately nod our head that metaverse will be the best suit for improving the quality of the patient care, and so on and so forth. But there are a lot of challenges and limitations. What is the truth behind it? So I just thought I can give you some challenges and some solutions as well. So if you look at the benefit, improved accessibility, personalized care for patient, these two are interesting benefits of metaverse. At the same time, these two benefits land up with a lot of challenges. So because you're giving improved accessibility, access to all, and all health care providers can have access to the user data, patient data, a lot of threats on data security is going to come up. So this is going to be a big problem which we have to resolve. And as you know that with the blockchain we have to definitely adopt blockchain to handle this. And just merely adopting blockchain also may not work out. We Because the amount of data, it's going to be a huge data, big data, medical data, and how that is going to be partitioned, and how the analysis, how the security is going to be ensured, it's going to be a different it's a different discussion. So let's not get into it as of now. Like how the data security can be ensured, because you through metaverse anybody can interact with anybody, and any avatar can interact with the things and the objects. If all those things are happening, then definitely there is a cyber attack issue, and that is resulting in what is called as data security. Then personalized care for every patient. Now, if you look at this point, this is an interesting benefit. Everybody would nod our head, but this is actually landing up with ethical concerns. So, if I have to give a personalized care for every patient, then the doctor or the other healthcare workers have to have complete access over the complete history of the patient. Everything will be known to all those people, right? So in that case there is ethical concern. So this is a problem, how the ethics of that particular person is will be preserved. That becomes a problem. Although COVID-19 and lockdowns have pushed metaverse for adoption by healthcare companies, still the healthcare infrastructures, medical professionals, and patients may not be ready to interact with the virtual dimension yet. Why? If you look at the reason for it, though there is a strong compelling need, we are not really willing to interact with the virtual world or the virtual dimension. The reason is there is a non readiness for change. Our attitudes, our mindsets are so firm, rigid, that we are not willing to move or switch over from the physical world to the virtual world. There is no trustworthiness in the process, because something everything is imaginary, and therefore there is always a dilemma whether the patient will not be really knowing, cannot have 100% faith, and that is the reason why they are not ready to interact with the virtual mechanisms. They have a fear of failure of that particular mechanism. Obviously, this is also correct from one perspective. So, what are the implementation challenges? If you look at that, there is a big question of the cost, upfront cost. Basically, if you want to implement it, there are a lot of cost which needs to be borne both by the hospitals, by the patient, as well as by the healthcare professionals. All the sectors have to be uh, they have to confront this particular implementation challenge. Each one of them have to bear the cost. For example, there are a lot of hardwares which have to be used for it, as I've already listed. the hardwares are going to be little expensive. We have VR headsets. We need to use something on our hands, gloves, VR gloves, and we need a very strong technological infrastructure. The internet connectivity, the bandwidth, the connection speed, everything have to be sufficiently higher to feel that digital immersive environment. All these things are mandatory. So this is one important problem. Next problem is uh, there is lack of interoperability, because if you take the traditional way of providing healthcare delivery, there is a standard available. There's a golden standard available. So based on that, the treatments are all given. But here we don't have such things. And because here in Metaverse, we can have a vast interconnection among different virtual worlds, there can also be compatibility issues and interoperability issues. So these things are also going to be a big problem. And how we can overcome this is, of course, we have to go for development of some common standards, some mechanisms, some regulations have to be laid down. This is also very, very important. So I'm also giving you the solution for this implementation challenge. And third is, so first 2 points I've told you. The third point is, it's a mindset which I'm again trying to hit here. So metaverse reminds us a fiction story, science fiction movie for all the people. So the lack of understanding about metaverse. So the awareness of the metaverse is not known to the patient, nor even to the doctors. Therefore, they always uh, uh, do not readily adopt this metaverse based tools, and therefore this innovative mode of therapy or innovative mode of healthcare delivery is not immediately followed by all these stakeholders. So we need to have good virtual platforms which can help and boost up this medical education. And apart from that, familiarity of this platform. This is very important. How many of them have the skill sets to work in this virtual platform? Not all of us have that. And slowly, slowly, only this can develop. So the familiarity is missing. Only when this some extra training has to be given to how to work in a virtual platform, and then only adoption of metaverse can gain momentum. So this is where we are actually now. So we to strengthen the medical skills and communication, lot of familiarity is needed. So not only for from the uh, hospital or from the other healthcare professional perspective, even the patient should be knowing all this. He should be a tech savvy person. That is what is the and for country like ours, like in India, where our illiterate population is huge, we cannot imagine to have an adoption of this metaverse immediately. So this is one of the important stumbling block in adoption of it in our country. So adoption of metaverse. Next, I just thought with the okay in the coming age of metaverse, with the maturity of technical advances in artificial intelligence, all the devices, gadgets, and you can deliver lot of services with increased computing speed, with the power, with the augmented reality, all these technologies. I'm just listing all the technologies. With all these things, it should be possible. Adoption should be possible, and it is expected. There was a prediction that was being made. The impact what this metaverse will have on healthcare. They found that it is to be crossing $3 trillion US dollars by 2030. By next decade, we assume that the metaverse will penetrate into the healthcare industry and will bring an economic impact close to $3 trillion, which is almost 2.8% GDP of our world and global GDP. And by next decade, that's by 2030, we expect it. Okay, so which means now we are in 2025. So within another 5 years, we expect this. So though we everything is favorable for adoption of metaverse, There is a delay in it because of three important reasons, which already I have discussed. So I'm just going to leave this. This metaverse is very is it's still in the nascent stage, and it is still at the experimental research test bed level. So there is, and all the healthcare professionals do not have expertise in using this metaverse concepts, and we don't have proper regulatory mechanisms which gives it guidelines for using this metaverse adoption. So all these three important reasons increases the delay in the adoptions. So if you want to, apart from the delay, if you want to infuse this metaverse in healthcare, make it, make the society more knowledgeable, make it more metaverse enabled. If you want to do that, then some challenges which the metaverse industry has to take up is the complete healthcare approach has to change. There should be a reinvention of healthcare approaches in the upcoming years, so that the patient as well as the healthcare providers experience totally a new immersive approach, and they should really be able to appreciate and understand, comprehend the benefits of this metaverse. And if what are the challenges they have to overcome, they have to bring down the operational cost for uh, all the stakeholders. Somehow all the industry should work hard to bring down the initial uh, money cost which is involved in the establishment of this metaverse environment in digital healthcare. And not only this, operational, apart from operational, bringing down the operational cost, they should also implement necessary mechanism for data protection, data security and privacy. These two things also have to be taken up. Then they need to convince the medical institution to invest in metaverse adoption. So these are all the ways by which sooner we can bring in, because because in most of this blocks it was given that there is a complete delay in the adoption of metaverse. Is there a solution for it to come out? These are the things, if we target all these things, then possibly it is in near future we will get into metaverse triggered healthcare services. So if you look at the future outlook of metaverse, we get enhanced learning experience, and the healthcare is going to be revolutionized. It's going to be transformed completely, and there's going to be a paradigm shift in healthcare, with all virtual and remote surgeries being done. And you can also have a hyper realistic social experience. It's something which is an amazing advantage which you can never get, because with this hyper realistic social experience, the blurring line between the physical and the digital interaction uh, just gets faded away. And apart from this, there is a seamless integration with the physical world. So all these are the future expectations on metaverse. So finally, I just like to say you something about the liability and the malpractice. See, whatever may be the case, however good the metaverse is, and we have seen so much of exhaustive list of applications and other things. But imagine there is some medical error which is going to happen in any of the virtual settings. Say, for example, it's a virtual surgery which is going to happen, and in that operation theater, there is some command, and that command is wrongly making the patient to get into a trouble. Okay, because of this, what happens? A medical error is going to introduce. Now, who's responsible for this error? Do we blame the doctor? Do we blame the patient? Or do we blame the digital environment? Or all this? So how do we blame, and where do we fix the error? On whom do we, who becomes liable for this? So this is what is the biggest trouble. That is one of the reason why the adoption is very important reason why adoption is very poor, even in developed countries. Leave our country, even in very rich countries, they don't get into it unless we have regulatory issues. All those things are brought properly, we cannot proceed. The next thing is, as I've already told, uh, the conventional healthcare will provide a standard, they have the standard healthcare avenues, and those standards have to be met by this virtual healthcare environment also. This also has to be adhered. Okay, how do we check whether the same level, the same standard has been kept in the virtual healthcare also? So this is another question, that it's a $1 million question which needs to be answered. Apart from errors, whether the standard of the care which is given is good or bad, how do we do the rating? That also becomes a problem. And another point is, now we know about the medical insurance. The same medical insurance policies which we use in the real world cannot be used for this virtual environments. We need to have bring out with different policies. So the insurers have to develop policies that reflect the unique risk associated with all the risk factors which are associated with the virtual healthcare, or needs to be included in their policies. So these are all some of the liabilities and malpractices which can happen in the virtual environment. Now, coming to the concluding remark, see, technological advancement does not happen in one day, one night. We cannot bring the change. It's going to continuously evolve. Okay, and similarly, we can also think that metaverse, in though it is not happening today or tomorrow, it will slowly undergo an evolution, technological evolution, and reach out to a level. So the level is, it's once it reaches that particular level, we can expect that there's going to be a paradigm shift, and it's going to drastically change the and transform the healthcare. So whatever use cases which I have listed, the potential applications, whatever I have listed, diverse applications, all those applications which I have listed is only the scratch of a surface. We have not dived deeper into it. So only when it starts implementing, slowly, newer ideas and newer unimaginable possibilities will come up. So in short, I would say the impact of metaverse is unimaginable, and it is going to bring in boundless possibilities for the healthcare professionals as well as for the patient.